the Medical Association. I want to welcome you all to today's call. Just a couple housekeeping items. Please note that we're going to try to keep the phone lines open. Today's call is a short call, so that way we can keep lines open so you can ask questions of our presenter. So please keep your phones on mute or be conscientious of background noise. However, if we do pick up a bunch, I'll go ahead and mute those just out of courtesy for our speaker. With that, Stacy, I'll turn it over to you.
Good afternoon, everyone. My name is Stacy Fredenberg, and I'm the Communications Manager for the South Dakota Foundation for Medical Care. As part of the Great Plains Quality Innovation Network, we're excited to be partnering with the South Dakota State Medical Association to offer a 10-part series of webinar briefs. Centered care topics have been presented in 15 to 20-minute webinar segments, highlighting provider and clinician perspectives while introducing corresponding resources and tools. Webinar, Principles of Interprofessional Team-Based Healthcare and Necessary Competencies of Team Members, will focus on working at the top of the license. Individual healthcare team members can vary significantly based on background, experience, and personal interests. Tapping into and taking advantage of individual capabilities increases productivity and job satisfaction. With that, I'd like to introduce our speaker, Bruce Vogt. Dr. Vogt is Professor Emeritus and former Chair of the Department of Family Medicine of the University of South Dakota Stanford School of Medicine, as well as Medical Director of the University of South Dakota School of Health Sciences Physician Assistant Studies Program. He also previously served as Program Director for the South Dakota Area Health Education Center and Dean of Graduate Medical Education for the School of Medicine. He's in Yankton, South Dakota. Thank you for sharing your knowledge and expertise with us today. Go ahead and begin your presentation.
Thank you, Stacy and Mark, and thank everybody for tuning in. I'm going to just do a quick test and advance the slide, and if somebody responds that slide it correctly, so we know that. Did that work okay?
Yep, Dr. Vogt, that worked well. Thanks.
All right. Okay. Very quickly, just about the objectives to describe core principles of interprofessional team-based healthcare and the competencies, and then I'll try to identify some resources that help develop and advance healthcare teams. Well, as far as some background goes, healthcare reform has, of course, focused on improving healthcare delivery, quality, safety, as well as cost. And professional or team-based approach is seen as essential by the experts in order to meet these goals. And there are a number of initiatives responsible for the increased emphasis on team-based care. Now, this concept of interprofessional or team-based healthcare is certainly not new. It's been promoted for at least 2 decades, really longer than that, and it's kind of had ebbs and flows in development, characterized by many terms. I've already used a couple now, but interprofessional, team-based, collaborative, interdisciplinary, multidisciplinary, and multi-professional are all terms you'll see used. Some folks will differentiate something like interprofessional and multi-professional to talk about involvement of only professionals, healthcare professionals as a part of the team. Interdisciplinary or multidisciplinary can speak about a wider breadth of members of the team. I'm going to use the terms interprofessional and team-based. A definition which modified by Dr. Naylor and her group is that team-based care is at least 2 healthcare professionals who work in a collaborative, coordinated fashion to accomplish shared goals and achieve high-quality patient care. This is congruent with the World Health Organization's concept of collaborative practice, although, as we'll see, the number of collaborators and the level of collaboration can vary widely. A term that you see used more and more is integrated, and often it's used loosely. Really, in this context, it is educational and interprofessional educational context. You're talking about an interprofessional approach characterized by a high degree of collaboration and communication by a diverse group of providers. And talk more about that, comment more about that in a little bit. In 2001, the National Academy of Medicine, which people probably know better as the Institute of Medicine, described 6 aims of improved health care. That it needed to be safe, effective, patient-centered, and patient-centered is a key component, namely efficient and equitable. 2008, the Institute for Healthcare Improvement, and this is a not-for-profit organization of a number of organizations established in 1991, but in 2008, they proposed the triple aim to optimize health system performance. And you have a reference at the end of the slides on Dr. Don Brick. And the triple aim has become the foundation of healthcare reform. And it focuses on improved patient experience of care, improved health of populations, and reduced per capita cost of health care. Well, if the triple aim is the key, if the key to achieving the triple aim is effective interprofessional practice, team-based practice, then effective interprofessional practice requires meaningful interprofessional education. The healthcare improvement developed what's called the Open School. Many of you have heard about it, but a professional development program with many facets: conferences, online courses, an international network of chapters. They have annual meetings, and they work with a variety of entities worldwide with the goal of achieving the triple aim. There's their next forum occurs in December in Orlando. Another was the World Health Organization, certainly, and in December in 2010, they had described a framework for interprofessional education and collaborative practice. A real significant development was in 2011 when the Professional Practice and Educational Collaborative, which is a group of really 6 and now 15 different health professional organizations, started an expert panel competency for team care. The goal, or a key component of this, was to be again patient-centered, to be put the interest of patients first and populations first. And they only described 4 domains of collaboration and 38 competencies. The domains were values and ethics, roles and responsibilities, interprofessional communication, aims, and teamwork. Actually, in 2016, they put out another paper where they had revised their original paper to some degree. To again put the emphasis that this all needs to be about interprofessional collaboration, they just defined one domain, the interprofessional collaboration as the single domain, and then the original 4 competencies, or the original 4 domains, became competencies with subcompetencies. Influences National Center for Interprofessional Practice and Education and their Nexus Learning Center. This is really out of the University of Minnesota. It's a federal contract, though, grant that was given. And they've been extremely active in helping people develop models for education and for practice. For Healthcare Research and Quality, AHRQ, many of you are probably familiar with. This is kind of like a primary care. National Institutes of Health have been very active. One of their initiatives was Team Steps, team strategies to enhance performance and patient safety. You may well be familiar with it. But with Team Steps, the emphasis is on the team's knowledge and on the team's skills and performance rather than that of an individual provider. And Team Steps has a variety of multi-missions for their curriculum, and it's quite popular. Background, let's talk about principles. And Mitch and all a paper describing 5 principles critical to effective team-based health care. And if you look at the National Academy of Medicine reference that I have at the end of the slides, you can go to that paper. But I've described 5 principles: shared goals of the team, clear roles for team members, mutual trust, effective communication, and enable process and outcomes being for continuous improvement. When we talk goals, you're talking about the importance of having well-defined, agreed upon goals, including commitment to the patient and family's involvement in setting those goals, and commitment to the team's work in providing the patient care. With regard to clear roles for team members, it needs to be agreed upon understanding of team's leadership and roles, the functions and responsibilities of all members. And I'll comment a little bit more about leadership shortly. There's there's collective responsibility for patient's care and acceptance of joint accountability of all members. And the premise is that the members of the team are working at their highest level of license, expertise, and ability to be effective. People are put in appropriate roles. Third being mutual trust, and this actually is critical, but you could understand very well that this may take some time as one gains an understanding of each other's knowledge, skills, and liability. And knowledge and skills part, at least, certainly speaks to the importance of interprofessional education early on in a person's career. Effective communication is the 4th principle, and it must be accurate, honest, unambiguous, and timely. And the measurable process and outcomes for continuous evaluation. Evaluation to determine if there's been success or failure in achieving team goals, as well, and positive patient outcomes is going to be a goal. Positive experience for patients is going to be a goal, but also team member job satisfaction. Working in a team-based care system can really lead to a great deal of job satisfaction as one works together on the patient's provision of care. And then under to determine success and failure in team performance, maybe patients are defined, but maybe there are things about the team performance that could be significantly improved. I'm sure that the range of competencies for interprofessional collaborative practices are quite broad. They're beyond specific, certainly to a given healthcare discipline, and involve things like teamwork skills and communication. And these competencies can be taught and can be learned, but it's important that meaningful education that occurs. This education must begin at the health profession student level. That is going to give you certainly the highest level of success. Now, as defined by the Interprofessional and Education Collaborative, which I mentioned earlier, and revised in 2016, are values, ethics, roles, responsibilities, interprofessional communication, and teamwork, as I said, with interprofessional collaboration as a single domain. Those competencies are designed to meet. We'll discuss them briefly, and then again, I'd refer you to one of the references where you can go to the IPE collaborative website. Values. Well, first of all, putting patients and relations first is important, as I've already said. Putting patients first, patient-centered. Another value is recognizing and accepting individual differences and cultural values of both patient and team members. Mutual respect is obviously important in developing trusting, honest relationships with patients, families, as well as, of course, the team members. One of the related to values and ethics is maintaining one's own professional confidence. Roles and responsibilities of team members with patients and family medicine and family members is, of course, critical, as recognition of one's own limitations and engaging other professionals and the skills they bring, on to enhancing team performance and collaboration is a third subcompetency of roles and responsibilities. And by the way, there are more subcompetencies in each of these areas, but I pointed out some of the important ones, I think, and again, you can look in the references to read more in depth. Competency, interprofessional communication, and this, of course, is in multiple ways, including, of course, technology. That electronic medical records can be very challenging, but also very powerful when it's a smooth system and people are competent in using them. In a team, one needs to respectfully express one's opinions and encourage those of other team members about one's own performance. However, that sensitive, instructive appraisal of others' performance be a goal of this, as well as accepting that of others, of one's own performance graciously. Similar to that, employing considerate language is important, particularly in difficult situations. It may be in a professional conflict, but professionalism is key. Two, team and teamwork go saying that the team needs to develop an ethical practice, centered and population-focused problem solving, and shared accountability for outcomes, which I've already mentioned. Also, integrating the knowledge and experience of others. Another aspect of the team is that it's important that teams are willing to function in a variety of roles. as needed. There needs to be some adaptability. A team member who is assigned to something may be uncomfortable with it. Another member of the team needs to be able to step up to take the responsibility, which then may require some change in other duties that have been assigned. There are many, many models of interprofessional team-based programs. Have offered a number of terms and modes of collaboration and levels of integration depending on a number of factors, including practice needs and feasibility. Some of the terms you'll hear are coordinated and co-located and integrated. Well, let's take, for example, a behavioral health primary care system. Coordinated system, you may have a referral and communication process, but that may be with outside specialty, about an outside mental health specialty service, and where there are separate facilities and even separate systems. They may be part of separate systems. A co-located situation doesn't necessarily mean, though, that a program is really integrated. Co-located can simply mean that there's shared physical space and referrals are internal, but there's still separate records and a looser affiliation. In an integrated program, such as an integration of primary care and behavioral health and primary care settings, it's a much more high degree of integration that they'll see there. Team may be extremely variable. And it could be a team of only professionals or a team of professionals and non-professional staff. Ideal needs of the patient population and services should be provided, should be determined first. Then, as often happens, is a group maybe decides, we need to do some care, some interprofessional care, and so they kind of look at the personnel they have and they decide they're going to develop a program based on that. Well, it's ideal to look at the needs of the patient population first. Leadership can be variable, and it can be a contentious issue sometimes. In most situations, physicians are in the lead role. Usually, when there are issues, it relates to scope of practice. Now, it's often appropriate for the physician to be in the leadership role, but this doesn't necessarily embrace the full concept of team-based. And look up a hospice situation, and as an example, it may well be that the chaplaincy service, the chaplain may be in the role of leader in a case like that. So the leadership can vary significantly and really perhaps is best served by the task at hand. Service could be very different than in a hospice situation, as I said. Ultimately, the degree of integration, the process by which team functions really dictates the extent of shared leadership and decision-making and responsibility. In the most integrated of systems, there's really joint and broad extent of leadership sharing and decision sharing and development of healthcare plans. I mentioned there are models that exist. There are many forms of those models too. It may be discipline or specialty specific, psychiatry or oncology, or maybe disease specific like diabetes mellitus or cancer. It could be very narrow, from an outpatient ambulatory program of diabetic foot care to an extensive rehabilitation program for brain injured patients, to a comprehensive integrated primary care practice. To give a couple examples, again, the primary care model, many people are familiar with that. The medical home, or the patient-centered medical home, that has been endorsed by the American Academy of Pediatrics, American College of Physicians, American Academy of Family Physicians, etc. And it's a primary care model, of course, in which the physician leads a team of individuals who collectively take responsibility. And as I said, that's often appropriate, but may always be best for the task at hand. And then I've referred to the integrated behavioral health and primary care system. Denver Health is a great example of that. In this setting, the behavioral health leaders are in working directly with the primary care physicians in the clinic. Members of the primary care practice, they give plans together. They may see patients together. It can be great because you can have a patient that maybe is in some crisis mode now and can be seen immediately. We also know there's a problem with a patient who is supposed to come back for a behavioral health appointment and they don't show up, where if you have a psychologist right there who can see the patient and then help rapport and schedule a follow-up visit, you're much more likely to be effective. Well, to say there are continue to evolve as we are in education and practice best practices evolve as they advance. I've got some references here you'll see that you might be interested in reviewing. Berwick, that's the key article on the AAA where that was proposed. And I have a number of other readings to look at, and there's some very long material that one can access by just going to these sites. So I'll pause for any questions.
Thank you, Vogt. I just wanted to ask, since you've been on the education end, and I know that the integrated practice is part of that system now, how are you seeing the team-based function with the generational differences, with younger providers more technology savvy and just how they communicate? Do you see how that team-based is playing with the generational differences?
I think it's still pretty early, in all honesty, and there's a lot of curriculum that has now been developed. But I mentioned meaningful education, and meaningful education is having like seminars a year where you put physical therapy and medical students and PA students, nurses together for lecture. There needs to be some didactic learning that way. There needs to be clinical learning. There needs to be also of activities like that. And I think that we're still early in the process, and there's certainly we know this when you talk about the tech-savvy things. We see a lot of students teaching a lot of physicians and other faculty of various types about the use of electronic resources. But I think it's still early, actually. Anything else?
I think Rick has the lines open if others have questions for Dr. Vogt.
Yeah, all phone lines have been opened up.
A key thing, you know, is again the importance of interprofessional education while the students are in their programs. Key to learning the skills of each other, respect for each other, and to prepare residents to be prepare graduates to be collaborative ready teams.
Yeah, I think it is a different mindset because providers can be pretty competitive, and to learn those collaborative skills and working as a team can sometimes be challenging in any environment. So.
And if you really don't have a good understanding about what the skills are in a given discipline and such, you practice in a biased, with a biased viewpoint.
Mm-hmm. Well, thank you so much, Dr. Vogt, for your presentation. I just want to remind everyone that the next webinar in the Provider Perspectives on Patient-Centered Care series is Analyzing Patient Panels and Health Outcomes, and it will be held at 12:15 on July 25th. As a reminder, there's additional information, tools, and resources for quality reporting and improvement on the Great Plains Quality Innovation Network website, which is www.greatplainsquin.org. We appreciate and value everyone's time and participation. Please take a final moment to complete the webinar evaluation upon exiting the system. Thank you, everyone, and enjoy your day.
Thank you.
Yep.